Hey, hello everyone, this is Dr. Shortness and welcome back to my channel. Hope you all are doing good. Today we are going to talk about the paralysis of the diaphragm. Diaphragm paralysis is the loss of control of one or both sides of the diaphragm. If only one side of the diaphragm is paralyzed, then this is known as the unilateral diaphragmatic paralysis, or you can say hemi-diaphragm paralysis. It can either be on the right side or on the left side. But when the both sides of the diaphragm are paralyzed, then we call it bilateral diaphragmatic paralysis or paralysis of the whole diaphragm. There are so many causes of the paralysis of the diaphragm, which I'll explain later in this video, but right now I just want to stick to the phrenic nerve palsy. You know, the motor supply of the diaphragm is solely by the phrenic nerve. If the phrenic nerve stimulates the diaphragm, then the diaphragm contracts. But somehow, if it fails to stimulate the diaphragm, then it remains relaxed. There are two phrenic nerves, right and left phrenic nerve. If one of them gets injured or crushed or anyhow fails to stimulate the diaphragm, then the half of the diaphragm that is supplied by that particular phrenic nerve will be paralyzed. Then you'll have the unilateral diaphragmatic paralysis. So one of the cause of the hemi-diaphragm paralysis or unilateral diaphragmatic paralysis is one-sided phrenic nerve lesion. But if both the phrenic nerves gets injured, or if you have bilateral phrenic nerve damage or bilateral phrenic nerve palsy, then both sides of the diaphragm will be paralyzed. That means you will have bilateral diaphragmatic paralysis. In both cases, unilateral or bilateral, it will reduce the lung capacity. Because you see, the diaphragm is the chief respiratory muscle, and if it gets paralyzed, then it will not be able to contract and will remain in a relaxed position. So here is the lungs. So let's bring the skeleton here. Okay. Remove the sternum. I actually brought the skeleton here and the lungs to show you the thoracic cavity, and have removed the sternum and the costal cartilages from here. So this is the thoracic cavity, and now you see when the diaphragm contracts, it actually becomes flattened and lowers down. So the thoracic cavity is actually increased. And you know, if the diaphragm remains relaxed, then it remains upwards. So the volume of the thoracic cavity is actually reduced. So there is no space for the lungs to expand. So what happens? The lungs will not be able to inhale more air because it has no space to accommodate more air. So if it gets paralyzed, the diaphragm, then you will certainly face some sort of breathing difficulty. That means the capacity of the lung is reducing. It cannot accommodate much air like it used to do before. So the diaphragm paralysis will ultimately lead to reduction of the lung capacity. So the patient will face symptoms mostly like this picture. As the diaphragm, that is the muscle of the respiration, is not working, she or he will certainly face some sort of breathing difficulties, as I have explained earlier, that the capacity of the lung has reduced. It cannot inhale more air from outside. So actually proper gas exchange is not happening. So there is no proper oxygenation of the blood, and carbon dioxide will also accumulate. So ultimately what happens in your blood, oxygen reduces and carbon dioxide increases. And due to this low amount of oxygen and high amount of the carbon dioxide in her blood, she will develop cyanosis. That means she will have the bluish coloration of the lips and fingers, the tip of the tongue. As you can see in this picture, this is cyanosis. There is a bluish discoloration of the lips, and also the you can see the tongue. This is not actually the lipstick as people may think, but this is cyanosis. It happened because of increased amount of the carbon dioxide in the blood. And also the blood containing the low amount of the oxygen and high amount of the carbon dioxide that is traveling to the brain and also to the muscle and every organs. So what happens? He will be very much agitated and insomniatic. He will be restless, and the muscles are getting less oxygen, and ultimately he will be fatigued. So these are the common features. So the patient will experience a shortness of the breath, headache, blue lips and fingers, fatigue, insomnia, and overall the breathing difficulty. In case of unilateral diaphragmatic paralysis, symptom will be very less. Even the patient may remain asymptomatic. But in case of bilateral diaphragmatic paralysis, this is a serious condition, and the patient will show severe symptoms and also may lead to respiratory failure. So immediate intervention is necessary in this case. So how do you diagnose it? Patient will complain about his or her symptoms, and you'll find some signs in your clinical examination, and also there are certain investigations. So unilateral diaphragmatic paralysis is diagnosed during the fluoroscopy, where the elevated hemidiaphragm is seen on the side of the lesion, and you will also find paradoxical movement. Now, this elevated hemidiaphragm and paradoxical movements, these 2 points needs to be discussed. Firstly, why will you see this elevated hemidiaphragm on the side of the lesion? I think it's better if I draw a figure for you. So let's open the notepad. I should open another page. New page, okay. Yeah, this is okay. So what I'm drawing now is the normal situation. This is the body, and this is the diaphragm, the right and left dome, and you can see these are the phrenic nerves that are innervating the diaphragm, and this diaphragm is now relaxed. Now, if the phrenic nerves stimulate the diaphragm, then it will contract, and when the diaphragm contracts, then it becomes flattened and goes a little down. So this is contracted state. So you can see this is the relaxed state when the diaphragm is dome-shaped and is in the higher position, and when it is stimulated by the phrenic nerves, then it contracts and it becomes flattened and goes a little down, as I've said earlier. And now if somehow one of these phrenic nerves gets injured, suppose this one, what will happen? This nerve will not be able to stimulate this portion of the diaphragm, and it will not be able to contract. So the situation will somewhat be like this. It will remain relaxed because it couldn't contract. But on the other hand, this side, this phrenic nerve is intact, so it is actually stimulating the diaphragm. So when this portion is stimulated and it is having an intact nerve supply, it will contract and it will flatten out a little bit. So during the inspiration, you will find one portion is raised and another portion is contracted downwards. Okay, this is number 1 point. Now my second point is, normally when the diaphragm goes down, then the vertical diameter of the thorax increases, and when the diaphragm stabilizes, the accessory muscles of the respiration like intercostalis and splenic, they start working. So what happens at that point? Those muscles, suppose these are ribs, those muscles, they are originated from the rib above and they're inserted below. So when these muscles contract, they are pulled upwards. Okay, so the ribs will be pulled above, and these movements are known as the bucket handle and pump handle movement of the ribs. And inshallah, if I get time, I'll make a separate video on the bucket handle and pump handle movements of the ribs. Anyways, if the ribs goes up, then the anterior, posterior and transverse diameter of the thorax will increase. So let's go back to the model and see if it works. So let's bring the intercostal muscles. Yes, and see, when these muscles contract, then the ribs are going up, so the anterior posterior diameter and the transverse diameter, they are increasing. So the contraction of the diaphragm, they actually increase the vertical diameter of the thorax, and when the accessory muscles of respiration like the intercostal muscle, then splenic muscle, when they act, they actually increase the anterior, posterior and transverse diameter of the thorax. Tahole overall the volume of the thorax increases, so they actually get more space so that they can accommodate more air. Now according to Boyles Law, the pressure is inversely proportional to the volume at a constant temperature. So according to this law, if there is less volume, like here, the pressure will be increased in this area, and if the volume is increased in this area, the pressure will be less. This is too hard for us. Forget about the law. You see yourself that suppose this is a box and this is another box, and you want to put 50 ml of air in this box, and you also want to put 50 ml of air in this box as well. So suppose in this smaller area, the air will exert more pressure as they are trying to find out some open space. But if you put the same amount of the air in the larger area, see, they're having a lot of space. so they can rest in peace, and they do not have to exert the pressure to find out a new space. So when the volume is increased, the pressure is less, and when the volume is less, the pressure is more. So the pressure is more in the congested area, and of course the pressure becomes less when the volume is increased. So the same thing happens here. When the thoracic volume, see the volume was less there, so the space has increased and the volume has also increased. So when the thoracic volume increases, the pressure decreases. So what happens? The pressure here will decrease. When the diaphragm was relaxed and the space was less, then there was much more pressure, and the pressure was positive pressure. But when the volume is increasing, then the intrathoracic pressure is decreasing to the point where the pressure becomes negative. So in case of thorax, when the diaphragm contracts, the pressure becomes negative. And you already know, when there is less pressure, in the negative pressure, then it tries to draw everything towards them from the high pressured area. So outside you have the air which is in the higher pressure. So when the pressure inside your thorax decreases, automatically the pressure will try to enter in your thorax, and that is how the air enters passively. And what my point is, when the pressure becomes negative here, it actually tries to draw everything inside. Even they try to pull the thoracic wall and the muscles inside, but it does not happen, because one of the function of the muscles of the thoracic wall and the diaphragm is to stabilize the thoracic wall. If the muscles somehow stops working or they do not work, then certainly they will be pulled inside. Now if one of the dome stops working, then with the action of the remaining dome and the other muscles, thoracic diameter increases, like here, the pressure will become negative again and will literally pull everything inside. This dome has already lost its function, so it will not be able to resist this pulling effect. So this portion will be further pulled inside, like this. And this dome will be raised than the normal level during the inspiration. So let's erase the normal position. Yep. So ultimately, if you see through the fluoroscopy and even in the chest x-ray, you'll find this portion of the diaphragm is raised higher. So this is the explanation of why there is elevated hemidiaphragm on the side of the lesion. On the other hand, if both the nerves are injured or have a lesion, then both the domes are paralyzed, then both of them, both the domes will be raised higher. So this is the explanation. In case of unilateral diaphragmatic paralysis, you'll have raised hemidiaphragm, and in case of whole diaphragmatic paralysis or bilateral diaphragmatic paralysis, you'll see that both the domes are raised higher than the normal level. Okay, so I think you can see some chest x-ray. So yes, this is a chest x-ray. I think before jumping into the abnormal one, you must see the normal one. So this is actually the chest x-ray. So this is the right dome of the diaphragm, you can see. This is the right dome, and this is the left dome of the diaphragm. This is the left side. You see the apex of the heart here, and you see this shadow. This is the lung shadow. So this is the normal one, and right dome is slightly higher than the left dome. Okay, this is normal chest x-ray. Keep it in one side, and now look at this x-ray here and see the difference. Look at the right dome. The right dome is raised. So if only one portion is raised, then we say the elevation of the hemidiaphragm. Okay, and also you can see the total volume of the lung, it has decreased. So the capacity of the lung, that has also decreased. So this is a typical x-ray of the right dome paralysis of the diaphragm. Okay, so that's it. Now, what is paradoxical breathing or the abdominal paradox? What is it? Normally when you inhale air, so let's see this picture. Normally when you inhale the air, your chest and your abdominal wall, both of them, they will expand. But in case of paradoxical breathing, see the abdominal portion here, it is coming inside instead of having a normal outward movement. This condition is known as the paradoxical movement. As the abdomen is coming down, this is also known as the abdominal paradox. So this is actually the movement in the opposite direction. It had to go outward, but it is actually coming inward. It is an abnormal medical sign that you'll find during the... Now, why does it happen? Normally, during the inspiration, the diaphragm descends down, right? So ultimately, it creates a pressure on the abdominal contents and they bulge forward. So there is bulging or expansion of the abdominal wall. But in case of diaphragm paralysis, you already saw, due to negative pressure inside the thorax, the diaphragm, instead of going down, it goes upward. So number one, there is no extra pressure from the diaphragm on the abdominal contents like it was giving before. So abdominal wall does not bulge out. It has to remain in the normal position. Number two, due to negative intrathoracic pressure, it pulls everything towards it. So the diaphragm goes up. Also, they try to pull the abdominal contents inside. So abdominal wall actually moves down due to the suction effect from the thorax. So you'll see this sign when you will examine the patient. And also I've said in the fluoroscopy X-ray, you will find the hemi diaphragm elevated, or both the domes are elevated. You'll find that. And also pulmonary function test can be helpful. As I've said earlier, that if the diaphragm is paralyzed, the effect will be the reduction of the lung capacity. So if you perform a pulmonary function test, then you will see that there is reduction in the vital capacity of the lungs. So in case of unilateral diaphragm paralysis, there is total about 10 to 30% reduction in the vital capacity. But in case of the whole diaphragm paralysis, there is about 30 to 50% reduction in the vital capacity of the lungs. So mark my words, if the whole diaphragm is paralyzed, then there is reduction only about 30 to 50%. But this complete diaphragm paralysis is a serious condition because it may lead to the respiratory failure. See, even the whole diaphragm is paralyzed, there is reduction of the vital capacity, mostly about 50%. So how the rest of the vital capacity is maintained? The rest were maintained by the accessory respiratory muscles. So let's bring the accessory respiratory muscles and remove the sternum. Yeah. So see, when the total diaphragm is paralyzed, then there is a reduction in the vital capacity of the lung about 30 to 50%. And the rest of the vital capacity, that is actually maintained by these accessory respiratory muscles. So what happens? They actually try to cover up this situation. And to compensate this situation, these accessory muscles, they start working harder. And soon they become fatigued. And gradually they stop working, and that leads to the respiratory failure. So this is a very serious condition. So the total diaphragm paralysis or the whole diaphragmatic paralysis is a serious condition which may lead to the respiratory failure. So I hope আপনারা সবাই বুঝতে পেরেছেন. I mean, you understand what I'm trying to say. Okay. So in this video you have learned the unilateral phrenic nerve damage leads to unilateral diaphragm paralysis, and bilateral phrenic nerve damage bilateral phrenic nerve damage leads to complete diaphragm paralysis. And how will you diagnose it? A patient will complain about the symptoms, that he will have some sort of breathlessness, then fatigue, insomnia, and sinuses will be there. And if you see the abdomen, then you will find the abdominal paradox. So these signs you will find in a patient, and also when you do the fluoroscopic X-ray, fluoroscopic chest X-ray, then you will find that in case of unilateral diaphragm paralysis, the hemi diaphragm will be raised at the site of the lesion, and in case of bilateral diaphragmatic paralysis, both the domes will be raised. So this is the summary. So yes, that is all for today. I hope you enjoyed this tutorial, and if you have any question regarding this topic, then you can ask me in the comment section below, and I'll try to answer. And my next tutorial will be on the hiccup, which is very common. So yeah, and if you think that these tutorials are helping you, then please subscribe my channel and do not forget to press on the bell icon. And if you have liked this video, then please give a thumbs up and please keep me inspired. So hope to see you all in my next tutorial. Till then, take care and goodbye.